Hello and welcome to the Telegraph Studios. I'm Alistair Greener and today we're discussing the importance of livestock to poor farmers in developing countries. And joining us are Dr. Peter Jeffries, who is the CEO, and Dr. Hamid Nuru, who is the Senior Director of Policy and External Affairs at GALVmed. Thanks for joining us. First of all, tell me, what exactly is GALVmed?
It's the Global Alliance for Livestock Veterinary Medicines. We're an organisation set up to develop products and to enhance market access for animal health products, particularly to the poor livestock keeper in Africa and South Asia. We're a charity, also a not-for-profit company funded by the Bill and Melinda Gates Foundation and by the UK government.
So are we becoming dangerously complacent about food security?
I'm not sure that complacency is the right word, Alistair. I think it's a question of the critical nature of what we're seeking to achieve. And it's obviously very different in the West to what we experience in Africa and South Asia. In the West, the concern is, can we go down to the supermarket and buy a chicken, be sure that it's going to be there, know that it's coming from a safe source, and that it's going to be something that's fit for eating. In Africa, it's very different. It's more a question of life and death in many cases. The poor farmers are producing a limited number of chickens at the village level. They're choosing whether to eat that chicken themselves, eat that goat themselves, or whether to sell it on and generate some income to support their family, for health, for education, and so on.
And I think that's also tied into, in Africa and in developing countries, into social security and peace. Because, I mean, when you have a lot of conflicts or you have a lot of natural disasters like droughts and floods and things like that, the term food security has a completely different meaning, really, in that particular sense, because it's the meaning of vulnerability and how are you going to continue, as opposed to food security in the West here, where you go into the shop and you just buy something, tomorrow it's always going to be there. So in Africa, it's a slightly different perspective to that.
Well, actually, I'd like to pick you up on the topic of vulnerability, because how vulnerable are the poor farmers to diseases of livestock and so on?
Well, it's been identified that livestock disease causes losses somewhere in the region of 25%. It's a very, very significant number. The losses associated with livestock disease, and in many cases those are controllable losses. And what we're specifically trying to do is to put in place a system that allows the products to be available, the means of distribution to be in place, so that at the village level the vaccinators, the farmers can buy the product and put it into the animals, and reduce significantly the impact of the associated disease.
I think also in terms of vulnerability, you have to look at it in the total kind of picture rather than just a narrow kind of a picture. You have, like I said earlier on, conflicts, climatic changes, environmental changes. You also have, to some extent, a lot of poverty, political instability. So, I mean, this is all tied into food security, really. There's a lot of vulnerability there. And also when it comes to things like understanding that there are solutions out there that can be used to help them.
So you talk there about solutions. So do they have the same access to the knowledge of how to be preventable with these sort of diseases?
That's a critical element, Alistair. I think the starting point is to say, if you go to the villages, are people aware that there are means of controlling disease? They've often lived with 80% mortality in a particular disease for all their lives, and yet there have been tools available for many, many years to control that disease. So we're trying to increase awareness. We and others are trying to increase awareness of the disease and the ability to control it. And we're also trying to look at how we can demonstrate to the farmers the economic benefit that accrues from use of animal health products, vaccines in particular, to prevent disease, and in allowing the farmer to make an economic decision to say, yes, this is a good use of my money. I will spend this amount of money and I'll protect my flock or my herd based on the cost. It's an insurance policy.
So when farmers hear this, that they're aware of the controls and so on, what's their reaction?
I think I can give you a classic example of that, Alistair, because people always tend to confuse and think that, if something is too expensive, farmers cannot afford to buy it, or poor farmers in Africa or South Asia can't afford to buy these products. People are human beings, first and foremost. They like to be given choices. They like to be seen. They like to see value for what they're getting. And that's what we try to do by bringing value, showing them that this is important. An example of a disease is East Coast fever. It's a disease of cattle affecting countries in East Africa. It kills calves, a 50% mortality in many cases. And the vaccine for that particular disease costs between 10 to 15 US dollars per dose, one single dose. That is extremely expensive by any standards, even here in the West. However, through the work that we've done, people have seen the value that it brings, because one vaccination lasts the animal for life, as opposed to other conventional methods of treatment of East Coast fever, such as when an animal is sick, you treat it, you can have a 50-50 chance it's going to die, or you have to treat against the ticks that cause the disease, which means you have to dip it, or spray it every 2 weeks for its entire lifetime. So if they do see benefit, they are quite willing to sell one animal or two animals, or even come together and sell one or two animals to vaccinate the entire herd, because they know that it's of economic benefit to them. So people should not really think that because it's expensive, farmers don't want to or cannot or are not willing to buy it.
So there are countless people involved, aren't there? There's charitable organisations, there's health professionals, there's NGOs, there's donor organisations. What exact role does GALVmed play in all of this?
Like you said, there are many players in that field. What we tend to bring to the field is three specific aspects. One is product development. Where there are no products, there are no vaccines or drugs, what can we do to bring those available to the people that need them? Many products are developed in the West, and they're not for diseases which we have in Africa. So how do we bring the product into being and transfer it to the commercial sector? That's the first thing. The second thing is delivery, product delivery, making it accessible to people, looking at supply chains, delivery systems, demand, supply, all that kind of thing. How do you get it to the farmer, not just to the farmer, but to the farmer's animal? Because there are lots of stages in between. It can be sitting on a shelf where the farmer can see it, but he can't do the injection into his animal, for example. So there are many stages in between. And the third and last thing that we tend to look at as GALVmed is the policy, creating the enabling policy environment by bringing into play the private sector, the public sector, the PPPs, and looking at how we can make that environment conducive so that there can be sustainability in what we're trying to do so that we can pull out.
So you talk about the effectiveness of those partnerships, but the real question is, what about sustainability? How can you be sure that the program you have and what you're doing is actually sustainable?
The traditional way of doing things in terms of animal disease control have been, you come in and you do like a vaccination or a massive treatment or a massive vaccination campaign, and then after several years, you pull out as a donor, and then things tend to collapse. Africa and Asia are littered with histories of those kind of incidences. So we have to look and study and understand the intricacies behind what do you need to put in place in terms of systems, protocols, methodologies, approaches, and try to plug those barriers or those gaps before you actually begin to introduce that product into the system, because that's a way in which you have better chances of it being sustainable, and also gives the spirit of ownership of that to the people on the ground, and gives them the capacity also to be able to do it on their own.
Yeah, we work through partnerships all the way, and the goal is to pick up other people's work, take it forward. I mean, there's plenty of good research out there related to tropical diseases, for example, but not a lot of conversion of research into product, and then from product into availability of product. And that's what we're seeking to stimulate, addressing market failure as it occurs, identifying the points where there are weaknesses in the value chain, and then walking away from it at the end, having put in place ideally systems which we know as we leave will be kept.
Now, you mentioned there about the partnerships and all these other people who are involved in the process. What do you see their role? How do they fit into this whole process?
So I think it's important to first of all recognise our donors, because we can do nothing without the donors that we receive funding from, particularly the Bill and Melinda Gates Foundation and the UK Government Department for International Development. So the donors are an important partner. Secondly, we look at research. So we're working with research institutes, picking up research that's coming out of those institutes and seeking to take it from the research stage to the developed product registered in individual markets. So we're filling that gap there. And then very often we're working with marketing partners. They may be commercial companies, international companies, local regional companies. They may be down to village level vaccinators, but people who are putting in place a system which allows them to generate income and meet a need at a local level. So we provide the product, we work up to the point where the product's available, we help in creating the market, but we pass it on to somebody else for the actual use of the product.
So I think the key word there is smart and effective partnerships. There are many partners out there, but how do you work smarter and more effectively in order to deliver what the farmer needs? So that's what we tend to work on, because we are a facilitatory, a catalytic organization. As opposed to doing the work ourselves, we do it through partners on the ground.
So ultimately, what is the desired result for organisations such as GALVmed?
For us, success will be that we don't need to be participating anymore, that we can look from a distance and see that things that we've initiated through us directly, through our partners, are now still in place without us continuing to fund them, continuing to be party to the work that's going on. So we need to find a way to be able to step right back from involvement at the earliest opportunity, but knowing that once we put something in place, it will stay there and it will continue to function. That for us is success. That's our exit strategy. We're not an organisation that's going to be there forever and a day, looking for ways to continue to be involved in projects. The goal is have our input, do our thing, move on to the next project.
Okay, well, you say it's long term. Let's play a quick game here. Let's fast forward 30 years. What do you see the big picture? How's it going to look like in 30 years' time?
So we've seen very, very significant changes in Africa and South Asia just in the last 10 years. You've got population increase very significantly, increased urbanization, increased middle classes in Africa, a willingness or a desire to buy more meat, increasing demand. As a result of that, the value of meat will increase. As a result of that, people will recognize the value in looking after their animals carefully and properly because of the economic value tied up in them. And I'm sure that there will be inevitably an increase in the willingness to vaccinate, protect their animals.
So demographic changes are happening and they are ongoing, exactly what you said. However, really understanding and trying to bring sustainable solutions and letting farmers know that there are solutions available in terms of animal health products that they can get access to, and giving them the ownership of that and putting in place the systems to allow that to happen, in a proper cycle, a full-blown cycle, so that we can move back and people are now beginning to take ownership responsibility and doing things on their own and getting access to these solutions. That's really what we want to see in 30 years' time.
Well, Dr. Hamid Nuru, to Peter Jeffries, it's been fascinating talking to you. Thank you very much.
Thank you very much. It's been a pleasure.